If you feel bloated after almost every meal, it's easy to assume something is wrong with your stomach. But most of the time, bloating is a normal physical outcome of a few predictable things: gas, fluid shifts, and how fast your gut moves. The helpful part is that those drivers are often changeable. In the next minutes, you'll get a clean mental model for why your belly feels tight, puffy, or pressured after eating. And you'll hear practical experiments you can try, one at a time, to see what actually changes your symptoms. Bloating can be uncomfortable, but it's not always the same as fat gain, and it's not always inflammation. Sometimes it's simply trapped gas meeting a sensitive gut. Sometimes it's a meal that ferments fast. Sometimes it's stress, posture, or speed of eating. Let's start by separating what bloating is from what it feels like, because that alone reduces a lot of confusion. Moving to slide 2. Bloating is a sensation and a shape change. The sensation is fullness, tightness, or pressure. The shape change is visible distension, where your abdomen looks larger. You can have one without the other. Some people feel intense pressure with very little visible change, because their gut nerves are more sensitive. Others visibly distend but don't feel much discomfort. That matters, because the fix depends on which one you have. If it's mostly sensation, the target is often gut sensitivity, stress load, and how the gut-brain axis amplifies normal stretching. If it's mostly distension, the target is usually gas production, gas trapping, constipation, or food volume and water shifts. A simple check is to notice timing. Bloating within minutes often points to swallowing air, rapid stomach stretching, or a strong gut-brain response. Bloating that peaks hours later often points to fermentation in the intestines. Getting the timing right is like finding the right address before you knock on the door. Moving to slide 3. A huge driver of after-meal bloating is swallowed air, also called aerophagia. It sounds trivial, but it adds up fast. You swallow more air when you eat quickly, talk while chewing, drink through a straw, chew gum, or wash food down with lots of liquid. Carbonated drinks add gas directly, and some people are simply more prone to trapping it. The stomach can vent some gas upward as burps, but if gas moves downward, it can create pressure in the intestines, especially if motility is slow. A practical experiment is to slow the first 5 minutes of the meal. Put your fork down between bites. Chew until the texture is mostly uniform. Keep sips smaller and skip straws for a week. If your bloating improves quickly, that's a strong sign you're dealing with air and speed more than bad foods. It's not glamorous, but it's one of the highest return changes you can test. Moving to slide 4, now let's talk about fermentation, because this is where I bloat after everything often comes from. Your gut bacteria break down certain carbohydrates and fibers, and gas is a normal byproduct. The issue is speed and location. If a food ferments quickly, or if it reaches bacteria sooner because digestion is altered, you can get a bigger gas load. A common cluster here is FODMAPs, fermentable carbs found in many healthy foods. That includes certain fruits, wheat-based products, onions, garlic, some dairy, and many sweeteners. This doesn't mean those foods are bad. It means your current gut setup may not handle the dose well. The most useful approach is not lifelong restriction. It's a short, structured trial where you reduce high FODMAP load, then reintroduce to find your personal threshold. If your bloating peaks 2 to 6 hours after meals, fermentation is a prime suspect worth testing carefully. Moving to slide 5. Constipation is one of the most overlooked reasons bloating feels constant. If stool is moving slowly, gas has less room to pass, and the intestines can distend more easily. You might still poop daily and be constipated if evacuation is incomplete. Clues include straining, hard pellets, a feeling of not being done, or bloating that improves after a good bowel movement. What helps is usually boring but effective, consistent meal timing, enough fluid, and the right kind of fiber for you. Some people do better with soluble fiber, which forms a gel and can be gentler. Others get worse if they suddenly add a lot of bran-like fiber. Movement matters too. A 10-minute walk after meals can support motility without being intense. If constipation is significant or new, it's worth discussing with a clinician, because persistent changes deserve a proper look. Moving to slide 6. Another piece is fluid shifts. After you eat, your body moves water into the digestive tract to help mix and absorb nutrients. Certain meals pull in more water, especially very salty meals or large carbohydrate loads, because glycogen storage binds water. For some people, that shows up as a tight, puffy feeling even without much gas. Hormones also influence water retention, so bloating can vary across the menstrual cycle. The helpful move here is to look for patterns, rather than blame a single ingredient. If bloating is strongest after salty restaurant meals, that's a clue. If it's strongest after very large portions of refined carbs, that's another clue. What might help is balancing the plate with protein and slower digesting carbs, and keeping sodium more consistent day to day. Consistency often beats perfection, because your body adapts better to predictable inputs. Moving to slide 7. Portion size and meal structure matter more than people think. Your stomach is designed to stretch, but rapid stretching can feel like bloating, even when digestion is normal. Big meals, very high-volume meals, and meals with lots of liquid can all increase that stretched, heavy feeling. Some healthy meals are huge in volume. Think large salads, raw vegetables, and high-fiber bowls. For some guts, that's great. For others, it's too much mechanical load at once. A simple test is to keep the same foods but reduce the portion by about 20% for a week. Or split one large meal into 2 smaller eating events separated by a couple hours. If symptoms improve, you've learned something important. Your issue may be capacity and pacing, not intolerance. You can still eat the same foods, just in a form and dose your gut handles better. Moving to slide 8. Let's cover lactose and other specific intolerances because they're common and often misunderstood. Lactose intolerance means you don't have enough lactase enzyme to break down lactose, so it reaches the colon and ferments, creating gas and water. The classic pattern is bloating, cramps, and loose stool after lactose-containing foods, often within a few hours. Fructose malabsorption can look similar, especially with large doses of certain fruits or sweeteners. Gluten is different. True celiac disease is an immune condition and needs proper medical testing before you remove gluten, because testing is harder after you stop. Non-celiac gluten sensitivity is debated, and may overlap with FODMAP effects from wheat. The practical takeaway is to test one variable at a time, with a clear time window, and track symptoms. Randomly cutting 5 food groups usually creates confusion, not clarity. Moving to slide 9. Stress changes digestion in a very real, very physical way. When you're tense, your nervous system shifts toward fight or flight, and digestion becomes less coordinated. Some people get slower motility and more constipation. Others get faster transit and urgency. Stress also increases visceral hypersensitivity, meaning normal stretching feels more intense. That's why you can eat the same meal on a calm day and feel fine, then eat it during a stressful week and feel bloated. What might help is not just relax, it's creating a pre-meal downshift. 2 minutes of slow breathing, a short walk, or even sitting down without multitasking can change how the gut contracts. Also consider sleep. Poor sleep makes the gut more reactive and cravings stronger, which can lead to faster eating and bigger portions. Think of stress as a volume knob on symptoms, not a moral failing. Moving to slide 10. Sometimes the issue is not too much gas, but gas that can't move. Posture and abdominal bracing can contribute to that. If you sit hunched after meals, or you habitually suck in your stomach, you may increase pressure and make it harder for gas to pass. There's also something called abdominophrenic dyssynergia, where the diaphragm and abdominal wall coordinate poorly, leading to visible distension, even without extra gas. You don't need to memorize the term. The practical angle is simple. After eating, try a gentle upright posture, relaxed belly, and easy breathing into the lower ribs. A short, easy walk can help gas move along. Some people also find that lying flat makes things worse, while lying on the left side can feel better because of how the stomach empties. These are low-risk experiments that can give surprisingly clear feedback. Moving to slide 11, let's talk about the microbiome without turning it into a buzzword. Your gut microbes adapt to what you regularly eat. If you suddenly increase fiber, add new supplements, or switch to a very different diet, you can get more gas for a while. That doesn't automatically mean the change is bad. It may mean your system is adapting. The key is dose and ramp speed. If you want to increase fiber, do it gradually. and keep it consistent for at least a couple weeks before judging. Also, pay attention to which fibers you tolerate. Some people do better with oats, chia, or psyllium-type fibers. Others bloat more with large amounts of certain legumes or raw cruciferous vegetables. If you're using probiotics, treat them like an experiment too. Some people feel better, some feel worse, and the effects can be strain-specific. Track your response, not the marketing claims. Moving to slide 12. There are also red flags. Most bloating is benign, but some patterns deserve medical attention. If bloating is new and persistent, if you're losing weight without trying, if you see blood in stool, if you have anemia, fever, severe pain, vomiting, or trouble swallowing, don't self-experiment for months. Get evaluated. Also consider conditions like IBS, which is common and involves gut sensitivity and motility changes. SIBO is another term you may hear. It's real, but it's also overassumed online, and testing and interpretation can be tricky. The point is not to diagnose yourself. The point is to notice your pattern and bring good notes to a professional if needed. A simple symptom log, timing, foods, stress, bowel movements, can make appointments far more productive. You're not trying to become your own doctor. You're trying to become a good observer of your body. Moving to slide 13. Here's a practical step-by-step plan that keeps you out of the random restriction trap. First, pick one measurable target for 7 days, either eating speed, carbonation, portion size, or a high FODMAP reduction. Second, track only 3 things: when symptoms start, how strong they feel from 1 to 10, and your bowel movement quality. Third, keep everything else as stable as possible. After a week, decide, did it change clearly, a little, or not at all? Then run the next experiment. Many people find the biggest wins from basics: slower eating, smaller evening meals, consistent hydration, and a short walk after eating. If fermentation seems likely, consider a structured FODMAP approach with a qualified dietitian, because reintroduction is where you learn the most. The goal is not a perfect diet. The goal is a calmer gut you can predict. Moving to slide 14. Let's wrap this up with a simple reframe. If you bloat after every meal, it doesn't mean you're broken. It usually means 1 or 2 systems are overloaded: air and speed, fermentation dose, motility, fluid shifts, or stress sensitivity. The fastest progress comes from matching the fix to the timing and pattern, not from cutting everything at once. Start with the low-effort levers. Slow the first minutes of meals, reduce carbonation, take a short post-meal walk, and check whether constipation is part of the picture. Then, if needed, test specific carbohydrate triggers in a structured way. If you want more videos like this, subscribe. And I'm curious, do you bloat more from big portions or from specific foods, A or B? This information is not a substitute for medical advice.